All right. Hello, everyone. A blessed Saturday morning to all the pet parents out there. So, here we are again in another exciting episode of Maxime Talks, where we talk about relevant matters about your dogs because your dogs matter. I am Dr. Raniel Montero, your host for this morning. So, previously, we were able to discuss important things to know about canine distemper and canine leptospirosis. So, quickly, to sum it up, we learned that canine distemper is viral in nature, while canine leptospirosis is caused by bacteria. And distemper is transmitted through direct contact from an infected dog and also through airborne. Leptospirosis, on the other hand, can be transferred to your dog's wounds upon contact on flood water or any body of water which is contaminated by rat's urine. So both can be treated, but not all dogs with these diseases can be cured. And the only way to control and prevent this from infecting our dogs is through vaccination. Let us always keep in our minds that prevention is always better than cure, and prevention is always cheaper than cure. So, to all our avid viewers, we are encouraging everyone to participate in our Webby quiz. So all you need to do is to answer the question that I will be posting during our live webinar. Just put your answer in the comment section below with the hashtag do good for your doggos. Only those correct answers with the hashtag do good for your doggos and only those comments during live webinar will be chosen to participate in our electronic raffle. I will only post one question, but we will draw three winners of both 1.5 kilograms of Maxim Elite and 500 peso voucher on your vet clinic or pet shop of choice. So don't worry, madali lang po yung ibibigay namin question. Kahit po nakapikit kayo, you can answer it. And of course, we will always want a healthy and an interactive discussion on all of our episodes. So please, we encourage everyone to please share your questions on our comments section below during our live broadcast and get a chance to win a prize. So, only those questions relevant to our topic or any other question related to pet welfare, pet care, and pet diseases that were commented during our live broadcast shall be considered for the raffle draw. And only one will be chosen as a winner of 1.5 kilogram Maxim Elite and 500 peso voucher on your clinic or pet shop of choice. So, of course, we are very happy to announce our winners from our last episodes. Okay, congratulations to Miss Marisol Cuesta, Mr. Angelo G. Tanoy, Miss Jonna May Ortega La Paz, Mr. Edgar De Jesus, and Miss Jesselyn Giliana. Each of you will receive 500 peso worth of pet shop or clinic voucher and 1.5 kilogram of Maxim Elite. Again, congrats guys. All right, so for today, allow me to welcome you to the Jurassic world of Dogo Parasitosis 101. And we will first focus on the external parasites which are pestering and living on our dog's skin and fur. So for today, we are with us again, our mainstay doggo expert, Dr. Jomar Castro of Consolovet Animal Hospital. So, hi Doc, a blessed morning to you.
Hi, Dr. Raniel, and good morning to all our viewers. It's another wonderful Saturday again today, and we're here to for another episode of Maxime Talks. I want to thank you for inviting me here to talk, and we're going to discuss another juicy topic for today. I hope you guys can watch and listen and learn. Thank you, Doc.
Yes, Doc. Since we're focusing on the external parasites, Doc, what's the perfect term for an external parasite infestation on our doggos?
Okay, actually, ectoparasitosis, as you can see here in the slide, it's an infestation with an ectoparasite, a parasite that lives on or in the skin. You have seen this a lot. You have experienced this one way or another in your dogs. And I know you will be very, very interested in what you will hear from us today regarding ectoparasitosis in your pets.
Yes, that's right. So, Doc, for today, we will further focus on ticks and fleas. So, yung mga garapata at saka pulgas. So, Doc Joma, ready ka na ba for our TikTok session? Alam
Yeah,
millennials.
Yeah, of course. Okay. Starting off with this very, very important problem in dogs in our segment here, TikTok. Uh, what we always see in our dogs, especially now, it's a year-round problem for all of us. We see three main insects, three main parasites we see in our dogs and in our cats. One is the ticks, number two is the fleas, and also we have mites. But we're going to focus on uh, solving the problem of ticks and fleas right now. So here in TikTok, where do we find them? Saan po ba natin sila makikita? Okay? Most of the time, when you see it in your dogs, you always think, akala mo, sa dogs lang siya meron. No. You have to be aware that they mostly live in cracks and crevices. Doon po sa mga pader ninyo, sa flooring na merong butas, na merong crack, doon po tumitira at doon po madalas at doon mas matagal nabubuhay po itong mga ticks and fleas. Okay? So, I want you to understand because you might see na baka akala ninyo napatay nyo na yung mga ticks and fleas in your dog pero you have not treated your floors, your walls, and your household, it will come back. Okay? It will come back. So, madalas ito nakikita also in other countries, madalas ito nakikita in brush, yung mga matataas na grass, in shrubs, and in wild undergrowth. But here in the Philippines, it's always commonly seen in your cracks and crevices at home. Kasi you might wonder, wala naman akong gubat sa bahay. No? Bakit kaya sila nabubuhay doon? Nabubuhay sila sa garden and nabubuhay sila sa flooring and cracks and crevices. Right, Doc?
Yes, that's right, Doc. Kasi minsan nagtataka sila na paano nagkakaroon ng ticks yung alaga ko? Eh, malinis naman. Ganyan. So, we should know that hindi porket malinis on our standard is okay na. Dahil hindi
Yeah.
yun yung standard ng ticks for their growth. Alright? So, since
Mhm.
napag-uusapan natin yung growth, I know this might seem very technical, but Doc, can we share a little bit information about ticks life cycle? Kasi I know this is also important that might help our viewers later on.
Okay. I want you to understand this very, very basic stuff about a life cycle. We are discussing this right now to you. This is not rocket science. Guys, I want you to understand this for you to know na meron po talagang buhay na dinadaanan yung yung mga garapata, yung ticks, para po malaman ninyo later on our following slides how you can control it at home in your dogs and in your household. Kasi dalawa po yung kailangan gawin for you to understand how you can prevent this from happening and how you can stop it and control it in your dogs and at your house. Okay? So, alam nating lahat that it lives po inside on your dog skin. Okay? Nakahalata nyo naman po yan. Pagka inoobserbahan nyo yung inyong mga aso, napapansin nyo maraming garapata po. Yung mga garapatang busog. You would always hear that sa ibabaw po ng balat ng inyong mga aso. Now, how do they live? Siyempre, they multiply. They reproduce. Okay? So most of the time, pag pumunta po siya, nag-reproduce po sila, it will take like around 1 week para sila mag-lay ng eggs So pag nag-hatch po sila, pupunta po sila, doon sila nag-hatch madalas po sa aso nyo, and nag-hatch din sila, bumababa kasi sila from the dog, bumababa sila sa floor, maakyat sila sa wall, doon sila nagle-lay ng eggs most of the time, sa cracks and crevices, and on your dog skin. So, when that happens, it will take around 2 more weeks before it becomes a larva. Ito po yung from the egg, magpupunta po siya sa larva, magiging larva na siya. So from there, mag-feed siya ulit. Mag-feed siya ulit sa dog nyo para makatulong po sa kanyang paglaki, para makapag-move on siya doon sa next stage niya. Yun na yung mga nymph, di ba? From larva, magiging nymph na siya. Yung nymph naman po, yun yung young adult. ng garapata. And it will take around, I think, more than a month para maging adult siya. So when you notice, it will take like around more than a month bago siya maging adult. Okay? Pero I want you guys to understand that when a tick is on your dog, it can live for months without food. Dun po sa cracks and crevices. Kaya you would notice when you remove the ticks in your dogs, usually nagbigay ka na ng medicine, oral medicine, collar, or dip, or bath, nawala na siya. After a few months, babalik na naman siya kasi kaya pong mabuhay ng garapata po dun sa ticks, dun sa walls, mabubuhay siya ng 6 months kahit hindi siya, wala siyang food. So, that is amazing for them. So, you have to understand that para you can know how to control it in your dog and in your house. Okay, Doc Raniel?
Yes, Alberto. So yes, so after we learned how ticks multiply and of course how
Mhm.
their life cycle works, Doc, syempre we want to know then, are there any specific body parts na makikita natin yung mga dog ticks na to?
Yes. Actually, there are specific areas in the dog where they like to live. Alam nyo naman yun. So minsan hindi nyo po napapansin, you don't notice them because your dog has a thick hair coat, lalo na yung mga breeds like Chow Chow, Shih Tzu, German Shepherds. Unless you really touch them and feel their coat, their skin, that's when the time you notice, meron pala silang ticks, meron pala silang fleas. Okay, you have to be very, very conscious about this. You have to really touch them and feel them. Haplusin nyo po para malaman ninyo kung nasaan. Kasi they usually hide under the collar sa leeg po. Hindi nyo mapapansin eh. They hide inside the ears. Okay? And if you don't really notice and flip the ear, you won't notice. Okay? Makikita nyo marami na. Yung mapapansin nyo lang po yung nasa muka. Like for example, near the eyelids. Pero underneath the body of the dog, like example dun sa armpits, between the toes, hindi niyo po napapansin yan. You have to notice this. You have to be very, very aware on how you will observe your dog regarding ticks. Kasi they bring so many problems and your dog will get sick. Okay, let me be sure of that. If you don't treat this, they suck the blood of your dog and it causes anemia in your dogs. Besides them delivering a problem, a condition and a disease in their blood, they suck the blood and it causes anemia and it's bad. And if this goes on and on, this is life threatening for your dog. I want you to understand that. Okay? I'm not scaring you, but this is true. Okay, Doc?
Yes, that's right, Doc. So guys, just a short trivia to you. Did you know that an adult female tick can ingest up to 100 times of her weight in blood? So imagine yung severity na nagiging cost nito. 'Di ba? Imagine if your dog has 100 ticks and each of those female tick can ingest 100 times her weight. Imagine the loss of blood that the dog can suffer, right? So ticks are also capable of spreading serious infectious diseases such as Lyme disease or other diseases, not just to your pets but also to us pet parents. So they can also cause tick paralysis that, of course, Dr. Jammer will discuss later on. Okay, so
Yes.
Doc, what might happen po ba or what can these ticks cause to our dogs if they remain untreated?
Okay. The ticks bring really a lot of diseases for dogs. Okay. But let me remind you right now, they don't really cause any problem to us humans. Yes, they bite. Sometimes they bite, but most of the time they stay in the dogs. They suck the blood. They become very fat. Once they bite the skin of the dog, they also dislodge various diseases in the bloodstream of the dog. Okay? In other countries, You might have heard of this. It's Lyme disease, but it does. We don't have this here in a tropical country. Mostly, this happens in cold countries like the U.S. because there are so many species of ticks in the U.S. And whenever they bite, they can bite also human skin. They also dislodge a problem called Lyme disease. It's a kind of serious fever in humans that we don't have here in the Philippines, thank goodness. So the problem here is they dislodge a problem, a condition called Ehrlichia. Okay, it's called ehrlichiosis, and it's a blood parasite that they infect dogs with. So, what the problem is, it's a common type of what we call dengue-like fever in dogs. So this is Ehrlichia. Okay. The next thing that happens to your dog, besides ehrlichiosis or canine hemorrhagic fever, they can also cause tick paralysis. They can cause seizures because of the excessive uh, anemia that has happened to your dog. They can also cause a nervous problem called tick paralysis. So you have to be very careful with this. You don't wait for this to happen. You have to prevent it from happening because when this happens, all these problems are life threatening. Okay? It's very, very expensive and very, very challenging for us vets to treat Ehrlichia and tick paralysis. You have to really avoid this in your dogs. Okay, dog.
Yes, that's right, Doc.
Mhm.
So, syempre, more importantly, I know, Doc, you can share with us some basic tips to control tick infestation sa mga dogs natin.
Yes. Uh, One of the very important things that I can share to you right now is how to really control it. Okay. As much as possible, I like you guys to prevent this from happening. Pero if it's very hard to avoid because you've got lots of dogs and it's very hard to really avoid it, you should have a foolproof plan to control it. Okay? So one of the easiest things to do is really remove it using tweezers. Okay? Pag konti pa lang po yung garapatan ng inyong aso, kaya nyo po itong gawin. But if maraming marami na po, katulad po nung excessive intensive na talaga infestation, it's very hard to remove it individually by tweezers because it goes by they reproduce and they increase in number by the hundreds to thousands in your dogs. So at first you can remove it individually, pero yun na nga, when pag dumami na siya, it's very hard to do that. Okay, let me remind you not to crush the ticks because it has blood in it. Okay? It does not mean that you crush it na dadami sila lalo. Hindi po totoo yun because they need to reproduce para dumami sila. Okay? And merong stages po yung eggs and yung life ng ticks para dumami po siya. Hindi po siya dadami. Kaya lang po, pag sumipsip po siya ng dugo, marami po kasing sakit na nandun sa blood na sinipsip niya sa dog. Okay? Sabi ko nga po kanina, they dislodge an organism also inside the bloodstream of the dog. So, you are trying to expose your dog and your environment to more diseases if you crush it. So, kakalat yung dugo, unang-una makalat, and so kadiri. So, anyway, when you remove it, just don't, what I do is like put it in water and put soap in it. Okay, usually that's the safest thing to do. Don't also attempt to put it in alcohol and or petroleum jelly. Okay, and most of the time people when they're really irritated by tick infestation in their dogs, what they do is they burn it. They burn it with a lighter, they burn it with a hot match, which is wag nyo na pong gawin yun kasi it's very, very unsafe and hazardous. And sometimes when you forget, you put it in, you like soak it in alcohol, minsan po kasi nakakain, naiinom pa ng aso. So what the problem is when they ingest yung blood, or yung tick mismo na maraming blood, they get much many more problems. Like I mentioned before, I want you to know na marami po talagang dalang sakit yung ticks. Bukod po dun sa Ehrlichia and tick paralysis. Okay, Doc?
All right, Doc. So thanks,
Mm.
Doc, no? And I think it's
Mm.
time for our web quiz right now. So
Wow.
ready na ba kayong sagutin ang question natin for today to get a chance to to win prizes? Okay. So our question for today, guys, para sa ating web quiz is madali lang. Ito, it's answerable of true or false. Okay? So, true or false? Ticks, or yung tinatawag nating garapata in our local term, are responsible for the spread of ehrlichiosis to dogs. Okay? So, what are you waiting for, guys? Answer this question on the comment section below. Just don't forget the hashtag do good for your doggos and your answer. Okay? So, Doc, while we were waiting for their answers, we have one question that's very, very relevant, I think. So, Doc, ang question is, does tick and fleas po ba contribute to excessive shedding of fur?
Yes, uh, yes. Should I answer the question, right?
Yes, Doc.
Okay. Yeah. Yes, they contribute really to excessive shedding of the skin. Why? Because whenever they bite the skin of the dog, okay, they cause an allergy, a type of allergy on the skin of the dog, making the hair follicles and the hair on the first layer of the skin of the dogs become weak. Okay, with this type, when this happens, it causes a type of allergy which they scratch and their hair become very dull, and it causes bald patches in your dog. So I want you to know na you might not notice this at first, but if this is excessive, your dog will be bald and it doesn't look good. And besides that they bring a lot of diseases in your dog, it destroys their hair. That's the problem. Okay,
Yes,
no?
that's right, Doc. Kasi
Mm.
minsan, Doc, no, especially on mga mababalbon or super furry or long coat
Yeah.
type of breed dogs
Mhm.
natin, minsan di natin napapansin na marami silang ticks. And then when we subject them to grooming, napakalbo natin siya, makikita natin that there are patches. So, madaming mga macules, red, mga rashes like that. Diba, Doc? So, very
Yes.
irritating yon on the part of our dogs.
Yeah. On our next slides, we will show uh, also the effect of fleas, which are more intense on the skin of dogs later on our next topic.
Yes, that's right, Doc. So,
Mm.
again, one last question, Doc, before we proceed to our next topic. During summer lang po ba ang ticks? Ito, medyo madalas sa ating tinatanong to on our consultations.
Okay. Most of the time, they are a year-round problem. Okay? Dito po kasi sa atin, it's a tropical country, laging mainit. Mas gusto po nila mabuhay dun sa mainit na lugar. Kaya hindi naman po, minsan kahit tag-ulan, I've noticed this, it's all year round. Wala po kasing winter dito sa atin eh. Sa States po kasi, sa US and other temperate countries, may winter sila. Minsan po nagiging dormant kasi yung buhay ng tick. Pag malamig, hindi siya makapag-reproduce kasi masyadong malamig. Ngayon, pero dito po sa atin, I'm telling you right now, kaya dapat yung tick prevention program that you will implement in your dogs, dapat po isang buong taon. Hindi po tuwing summer lang. Dumadami lang din po pag summer kasi po, mas mainit po pagka summer. So marami din siya. Pero it lives even during the rainy season, it thrives. I hope I answered that question.
Yes. Thanks, Dong, no, for answering the questions of our viewers right now. So I think we are now ready to reveal the answer for our web quiz. Okay, the answer is true. Yes, garapata or yung ticks, they help or aid on the spread of ehrlichiosis to our dogs. So, congrats to all those who answered it correctly, and we will choose three winners that will receive 500 peso worth of vouchers para sa pet shop and clinic, and of course 1.5 kilograms of Maxime Elite. Congrats! And so, para
Congratulations.
naman, yes, Doc. And to those who not get it, better luck next time. Marami pang episodes, marami pang chance. Okay, so Doc, we have here a few questions again that I think kailangan natin i-answer. Ito, one question. Is it safe to use Sevin to kill ticks? I think ito Doc yung ano, no, insecticide, yung Sevin.
Yeah, actually, it's always been a question, always a question that I hear every time here in Consult a Vet and in most of my webinars. Okay, Sevin kasi is a pesticide. Okay, most of the time it is used as a termite control medicine. Okay, nabibili po itong Sevin kasi most of the time sa hardware yata, sa hardware. So, once na meron kasing madali, usually people just buy kung ano yung madali eh. I'm telling you right now, this is toxic to dogs. Okay? In the US, they have a study that they did that it is highly toxic for dogs. Usually, this is a powder form yata. Powder ba o liquid? Pero most
Powder.
of the time powder ito eh. So ano nito, ang main use nito is for termites. For termites. Ngayon, yes, it will kill the ticks, but let me be honest with you, it can also kill your dog. Okay? So package deal siya. Pagka binigay mo siya, toxic siya sa ticks, toxic din siya sa dogs. So I want you to be careful with that. Okay? I want you to always be careful when using stuffs like this. Hindi porket madali po siyang bilhin, gagamitin nyo na, nasa hardware lang siya. Meron pong mga nararapat na chemical at gamot na pwede pong gamitin sa kanila para mapatay po sila ng mas safer for your dogs, and safer for you, humans, owners. Para sa ticks po, may mga nararapat na gamot. So, yun po ang gamitin natin. Huwag po Sevin. Kasi I already had a patient here in the clinic who got poisoned with this kind of chemical. And it's life-threatening to do that. Be careful in using this. I hope I answered your question. Thank you, Doc.
Yes, I think Doc na hindi lang natin nasagot yung question na yan, kundi nabigyan pa natin sila ng reminder. Kasi, we have to always consult yung mga veterinarians natin on everything
Yes.
that we will give to our pets. Kasi may mga adverse and harmful effects yung mga ibang gamot that we are not aware of. So, kailangan natin ma-educate on that part.
Always
Right?
consult your vet.
Yes, that's right, Doc. So, Doc, the one last question for this portion, no? Ito, why are dogs more prone to ticks and fleas than cats?
Okay. Meron din pong you might be wondering bakit walang ticks. Yung ticks kasi ng dogs are very very specific for dogs. But also in other countries, we might not see it here. Cats also have ticks in other countries. It's a different type and species of tick that cannot be found in dogs. So, meron ding tick po yung cat, pero bihira po dito sa Pilipinas. Actually, wala halos po dito. Most of the time, fleas lang po ang dinadala ng pusa. Okay? Ngayon, yung ticks po ng pusa, hindi naman niya po na ililipat yun sa dogs. May specific po yung dog tick, yung garapatan ng aso, sa aso lang. Nakukuha niya po yun sa environment or sa other dogs. Yung fleas naman po, nakukuha ng pusa also from the environment and from other cats. Okay? Now, the fleas in the cats, they can also transfer to dogs. Okay? So, mamaya may ikikwento po ako sa inyo tungkol dyan. But, specific lang sa kanila, usually, itong mga ticks and fleas. Okay? Minsan, nakukuha po nila ito sa stray dogs. Sa ibang bansa po, nakukuha nila ito sa wild animals. Okay? Yung mga rodents, yung mga raccoon, skunk, yun mga, doon nila nakukuha to eh. Pero dito po sa Pilipinas, naipapasa-pasa lang po ito from cat to dog pagdating po sa fleas, and from cat to cat pagdating sa fleas, and pagdating naman po sa ticks, from dog to dog. So yun po yung mga naipapasa lang niya specific sa dalawang hayop po na yon. Sana po naliwanagan po kayo tungkol doon. Pero po most of the time, naipapasa-pasa lang po ito. Example, meron po kayong kapitbahay na maraming aso, hindi naman sila nagtitreat, lilipat po yung ticks from their house to your house pag hindi po kayo nagtitreat sa dogs nyo. Ganun po ang cycle nito, yung cycle ng infection. So, naglalakad po itong ticks eh, tsaka fleas, tumatalon. So, from bahay to bahay, mabilis po ang transmission. Yun. Thank you, Doc.
Thanks, Doc, for that, for answering those questions. So, all right, Doc, moving forward from one crawling parasite to a jumping one. So, Doc, can we share some basic things about fleas?
Yes. Uh, this is also a very, very common parasite. Makikita niyo po sa dogs niyo din. And these are much smaller insects compared to ticks. Okay? They also suck blood. I want you to know that. But they don't suck as much as ticks. Ticks kasi, di ba, they become engorged yung malaki. May joke nga, di ba, yung garapatang busog. Okay? So, itong fleas, they also suck blood. Pero tumataba rin sila, pero hindi sila nagiging katulad na bondat na ticks. Katulad po ng mga garapata, hindi po sila ganon. But the problem here with fleas is they emit whenever they bite the skin of a dog, they emit a chemical that is very, very irritating. Nasubukan ko na po ito, alam nyo, pagka meron po kayong alaga na merong fleas, hindi nyo po napapansin, tumatalon ito eh. These are the long distance jumpers in the parasites, okay? They can jump, you would think na baka pag tiningnan nyo siya sa hair ng aso nyo, you would think na lumilipad siya. No, they don't fly. They jump. Record show, data shows that they can jump as high as 5 feet. Taas, di ba? Ang galing, ang layo. Now, you think lumipad siya pero hindi, tumalon siya. So kapag tumalon siya sa akin, tumalon siya sa balat ko, pwede niya po akong kagatin. And napakahapdi po niya mga gat. Kasi nga po, they emit a chemical that they dislodge dun sa skin ng aso. Tapos irritating siya. What the dog will do, kakagatin niya yung balat niya. Or scratch it intensely. Severe scratching, which causes severe damage sa skin ng aso ninyo. Yung po ang nangyayari. So, on the next slides, we will know kung ano po yung nagagawa naman ng pulgas, kung ano po yung life stages ng pulgas pagdating po sa buhay niya kasi we will also check out how to control it, right, Doc?
Yes, that's right, Doc. So just like what we discussed with ticks, we need to also understand yung life cycle ng fleas. Doc, can we run us through the life cycle of fleas on a non-technical approach?
Well, katulad po ng I want you to understand this very, very basic understanding nyo rito. Yan po yung stage ng kanyang buhay para malaman nyo ulit, katulad po dun sa garapata, mai-compare nyo kung paano nyo kukontrolin. Kasi usually, meron na pong mga makabagong medisina ngayon that controls both the ticks and the fleas. Kaya po inaaral natin yung life cycle. Ngayon, pag nasa aso po siya, in 2 to 3 days, nagre-reproduce po sila, nangingitlog po sila. In 2 to 3 days, mangingitlog po sila. Ang nangyari po dyan, the eggs of the fleas will stay in your dog. Pero most of the time, it falls off. Kasi nagsascratch siya eh. Pag nagsascratch siya ngayon, magfo-fall off yan sa floor. Usually, they fall off and stay in the carpet. Kaya pag may carpet kayo at kung may aso kayo, dapat alam nyo po kung paano iti-treat din, not just your dog, but also your carpet. Okay? So, bago siya lumaki at maging larva, it will take like 10 days. Okay? So, ano siya, magkakaroon siya ng metamorphosis, magiging larva siya. Okay? In 5 to 10, usually in 6 months, tagal din po, yung larva niya mag-move on para maging pupa. Tagal. So, kinikwento ko na po sa inyo na whenever they fall off the ground, they fall off the carpet, magsistay siya doon 6 months. So, kailangan bina-vacuum nyo talaga yung carpet ninyo. Meron kayong ginagawang chemical sanitation na ginagawa nyo sa floor, sa walls, at saka sa carpet. Kasi doon po siya mabubuhay ang matagal. 6 months. Kahit hindi po siya masyadong kumakain, mabubuhay siya ng ganon. After nun, when he grows more, nagiging adult na po siya in 2 months. Padami po rin ng padami to. Kaya ito po, from my research, I think they can live like for a year in your household. Tagal, di ba? Wow, that's amazing. And if you don't understand this, pabalik-balik lang po yung fleas na to sa aso ninyo. And meron din pong dalang sakit ito sa inyong mga alaga. Like yung ticks, meron din pong dalang sakit yung flea. Bukod dun sa severe irritation, severe scratching, marami rin po, may sakit din pong dala to. Katulad din po ng ticks. Okay, Doc?
Yes, that's right, Doc. So, the reason why we need to understand flea's life cycle is, of course, para mag-guide tayo on how to control it. So later, Doc Jomar will guide us on how to properly address these little monsters. So, but for now, let's talk about fleas, on how fleas infest our dogs. So, Doc, can you share to us how fleas infest our dogs?
Yes. Yes, your dogs naman really can pick up fleas directly whenever there is an infestation. Kakahawa-hawaan direct contact. Usually, ang nangyayari pag merong aso, number one, primary host ng fleas yung pusa. Okay? So you have to watch out. Yung mga household dyan, yung mga bahay po na may pusa, kailangan po i-treat nyo yung pusa nyo kasi dala-dala ng pusa po ito sa aso. So tatalon po from pusa to aso, tapos tumatalon din po ito from pusa to pusa, from cat to cat, tumatalon din po to from cat to dog, tapos tumatalon din to from dog to dog. So ang dami niyo pwedeng panggalingan. So whenever you have a cat, it's almost like 100% sure your dog has a flea. So magkakamot siya ng intense, tapos magsusugat siya kasi nga irritating yung balat. Yun po yung mga that's how they get it. Okay? So on the next slides, we will show you kung ano yung mga signs, right, Doc, nung flea sa aso ninyo.
Yes,
Okay?
Doc, that's right.
So, whenever your dog is siyempre severely scratching, so kamot siya ng kamot, di ba? Ang nagsusugat po nai-injure yung skin, nagbe-break yung skin, namamagana yung skin, meron ng wound, nagkakaroon po ng pus pagka hindi nyo ginamot. So, namamagana yung balat niya, kita nyo, nagsusugat na siya, tapos nagkakaroon po ng pus or yung nananga doon sa balat niya, namumula na ng todo and nagkakaroon po ng tinatawag nating hotspots. Yun yung tingin nyo, hotspots. Usually, hotspots is the number one culprit of hotspots is fleas. Hindi naman usually, hindi po heat, hindi po summer temperature, hindi po yon. Number one po talaga fleas. Okay? You would notice on the skin of your dog when you check it out, di ba? When you wave off the hair, may makikita kayong specks of black. Ano po yun? The specks of black, kahit wala kayong nakikitang fleas, it means he has a flea infestation. Bakit po? Bakit hindi nyo nakikita yung nakikita nyo, droppings lang, yung flea specks lang ang nakikita nyo? Kasi po, poop niya yun poop yun ng flea. Ngayon, mabilis lang po kasing gumalaw yung flea, unlike sa, di ba, unlike a tick, pagka engorge yung tick, pag punong-puno siya ng blood, mabagal siya para siyang pagong. Yung flea po, nakakatalon ng 5 5 feet high kahit nabusog siya. So hindi mo siya nakikita. Talon siya ng talon eh. So ang nakikita mo lang, yung flea droppings, yung black flea droppings. So you have to check this out and be aware na akala mo walang flea, pag may nakita kang black flea droppings, marami pong fleas. Okay?
Yes, that's right, Doc. So, just like with ticks, Doc, what can be the consequences if fleas are remain neglected or untreated?
Okay. So here, sa next slide natin, itong next slide natin, sabi ko kanina, they cause a lot of problems. So whenever your dog has ticks and fleas, ito na naman, anemia na naman because of their blood-sucking behavior. It causes anemia. Now, because of the flea saliva that I mentioned earlier, that they emit on the skin of of the dog, they have a special type of allergy. We call it flea bite dermatitis. That's the description of the skin of your dog whenever he has fleas. Namamagana siya. Flea bite dermatitis po yun. Kasi nga yung redness, makikita nyo, swollen siya, meron ng pus. Yung allergy niya severe. Nakakalbo po. So, magkakaroon siya ng bald spot, patches. And it's very, very sad to see na merong ganon. Now, like I mentioned earlier, they carry a disease. They carry tapeworms because I will explain it to you how. Because whenever uh, a flea ingests tapeworm eggs coming from other dogs then, okay, nai-ingest niya po yung tapeworm eggs. Ang nangyayari po, pag severely infested of fleas na yung dogs nyo, na i-ingest niya po yung flea. Hindi po malayo mangyari yun kasi highly probable na ma-i-ingest niya, makakain niya rin po yung flea. Pag nakain niya po yung flea, yung flea po, meron ding tapeworm eggs na nakain niya, nag-feed siya doon sa floor, nakuha niya yun sa flooring eh. So, nagkakaroon na po siya ng bulate, which is yung tapeworm, which is very, very severe that causes diarrhea din. So, your dog has been infected with fleas, may flea bite dermatitis na siya, tapos meron pa siyang tapeworm infection. That's sad. And it's really life-threatening din yun pagka it causes diarrhea, bukod dun sa skin ng, ng dog nyo. And it happens all the time. Actually, here, in my patient, it happens all the time. Thank you, Doc.
That's right. So, yun, guys, we have learned na whenever your dog has fleas, it is almost always, it also has tapeworm. So, di ba? It's a double jeopardy. So, Doc,
Mhm.
so we are down now to the very most important part of our discussion. So, Doc, can we
Mhm.
share to our pet parents the means on how to control and most importantly, how to treat ticks and fleas infestation? Because I believe, Doc, we have plenty of choices na ngayon on treating ectoparasitosis. Kasi from topical treatment, we have now oral medications, right, Doc?
Yes, there are very modern medicines right now that can be used to treat and control ticks and fleas. So most of the time, it's already a one-shot deal, one medicine na lang that you can give, and it will kill both ticks and fleas. But people forget, this is the most important thing that I want you guys to remember, na hindi lang po dapat ang aso nyo yung ginagamot. You have to also treat your home. Dahil nga po, katulad kanina, kaya inuna namin i-explain yung life cycle, dapat po muna ninyo talaga maging malinis kayo sa bahay. Eh, nung malinis naman kayo sa bahay, lalo na ngayon, meron tayong mga COVID safety measures na ginagawa, you should also increase the fact that you should also treat your home. Okay? So, ang gagawin nyo po, lalo na dun sa mga carpet nyo, usually bina-vacuum po yan. Eh. Merong chemical na tinitreat dyan sa mga carpet eh, para mapatay nila yung flea eggs. Okay? Doon naman so sa floors and walls, meron pong chemical na ini-spray din. So they spray insecticides dun sa kung saan po nagsistay yung pets ninyo. Dun sa cages nila, yung beddings nila, if they live inside your bedroom, meron pong insecticides which are safe for dogs and for humans. Huwag po kayong gagamit ng Sevin, so like I mentioned earlier. So, for you to control at mapatay nyo, bukod po dun sa gamot that I will discuss later that you will give your pets, you should also disinfect, sanitize, and clean your furniture, your home, and your household. Thank you, Doc.
Yes, all right, Doc. So, for the treatment, Doc, ito, very important na tong part na to. So, can you share us
Yes.
the treatment protocol
Okay. I
that
will also again mention this for you not to forget. You have to consult your vet, okay? Kasi po, why? Why do you, I always say that? Because the vet will determine what kind of treatment should be applicable for your dog. Example, your dog might be severely infested with ticks and fleas, di ba? So, meron siyang ipe-prescribe na gamot which is available in the market already. Usually, mga uso ngayon, yung mga oral medications, I will discuss it later. Pag binigay po kasi yon, guys, knockdown effect kagad yun. It works as soon as possible. Usually, they have time for that, like usually 1 to 2 hours. Kailangan po kasing ma-determine ng vet which medicine should be applicable eh. Kung severely infested, he might be prescribing a spot on medicine, or he might be needing a spray, or he might be needing a chewable tablet. Yan, yung chewable pill na kailangan na pong ibigay sa kanya kasi kailangan mapatay na po kagad at the shortest possible time yung garapata. Kasi may iba pong medicines eh na works medyo slow acting. It takes like a few hours, like a day, before it really removes the ticks. If your dog is severely infested, naku, kailangan po tanggalin na kagad in just 2 hours. Pag hindi pinatagal po yon, your dog might be that's life-threatening pag pinatagal nyo. Kaya kailangan pong kumonsulta sa veterinaryo. Napakarami pong gamot na merong fast-acting, ang tinatawag po nila. Meron din naman pong slow-acting. So you have to consult your vet. So the medicine is transmitted to adult fleas. Paano sila namamatay? Pag kinagat po nila yung balat. Kasi the medicine spreads on the skin. Systemic po yung effect. Pupunta po sa balat ng aso ninyo. Pag kinagat po yun, pag sumipsip po siya ng dugo, namamatay po yung garapata and yung fleas. Okay? Yun yung mga kailangan. These pills are very, very safe, and these pills, they like it because it's usually flavored, and you should learn how to do this. Thank you, Doc.
Yes, Doc. I believe, Doc, meron pa tayong mga modern ways of treating this problem.
Yeah. Actually, meron pang collar, meron pang spray, may spot on, may yan. Yan, usually, meron po kasing specific use yan eh. Most of the time, yung spray is used on younger animals. Yung collar naman can be used in older animals. And these collars right now are very, very also effective. These collars I use in one of my dogs kasi usually the duration of its effectivity is longer than any other product that I have known. Usually it works for 8 months. I will not mention the brand, pero merong ganun eh. I placed a collar in my dog and it worked for almost a year. Ang galing, di ba? That's amazing. And super tipid yun. Kaya I like using that. And most of these modern collars are non-toxic and water resistant. So, ang galing, di ba? Ang galing. So, I use it most of the time in my big dogs. Kasi, matagal. Tsaka mas matipid for me. Dami kong dogs eh. I have 13 dogs. So, these are the things that I use in my dogs. Dog.
Yes, that's right, Doc. So with the advent of modern technology, ang dami na ring na invent or na-discover na mga new ways on treating this kind of infestation. So it helps us too
Yes.
para maging more practical, 'di ba? Maging practically approach natin on controlling this kind of infestation. That's right. So,
Yeah.
and of course, what a better way to restore the health of your dog's skin and fur after ticks and fleas infestation is to give them the proper nutrition. So studies show that providing a healthy diet with omega-3 and 6 helps bring back your dog's healthy skin and shiny coat. All right, so try Maxime Elite now. And of course, we have good news for shopaholic pet parents out there. We are on sale on Shopee and Lazada. Just log on to your Shopee and Lazada account, search and shop for Maxim products, and enjoy up to 30% discount. So to experience top-notch veterinary care for your dogs, schedule an appointment now and get in touch with our doggo expert, Doc Jomar Castro at Consulta Vet Animal Hospital. So what are you waiting for, guys? Call him and schedule an appointment at the numbers posted on your screen. And yes, so this episode wouldn't be complete without our online consultation portion. So, Doc Jomar, here is our first question from our viewers.
Please.
Ito, Doc. So, uh, may mga side effects po ba ang tablet for anti-tick flea?
Okay. I understand you have watched some of this in Facebook or in the internet na baka nagkakaroon ng seizures yung aso, di ba? Usually may mga ganyan ako nakita sa Facebook and sa internet. And so far, honestly, I am not really endorsing these products, pero I'm using it. Okay? I'm not really, ano, fond of, kasi sometimes they say they cause seizures. But in most of my patients, wala pa ako nakitang seizure in giving this. Usually, I'll mention the products. I usually NexGard, Simparica, Bravecto, marami pa po eh. Yan yung mga chewable tablets. Now, uh, as a rule of thumb, okay, remember this, don't forget, okay, you have to have your dog checked. For example, most of the time kasi, when your dog is old, senior dog na siya, marami na siyang conditions. And hindi natin alam, baka meron siyang epileptic seizure na hereditary sa kanya, na meron na siyang, marami na siyang sakit, usually nervous problems. And you have to consult your vet first before, kaya nga sabi ko kanina, you always consult your vet before giving these medicines. Kasi sometimes it interacts with other conditions. Like for example nga, epileptic seizure, pagka matanda na yung aso mo, na minsan it's a very rare case, I guess. Pero ako, so far, I've used it every day for how many years? Wala pa naman akong pasyente na nagkaroon ng side effect nung pinainom nito. Wala pa po, kahit isa. So, in my conclusion, in my practice, I think it's safe. It's safe as long as you consult your vet before giving it. Yun na po. If it's a young dog na wala masyadong condition, you don't have to consult your vet. Just give it. Okay lang yan kasi ang dami ko ng pasyenteng ganun. Pero kapag may condition lang, pag matanda na po yung aso, marami ng condition, kailangan kumonsulta lagi sa veterinaryo bago magbigay ng bagong gamot. Di ba? Yun ang tama. Para for safety measures and preventive incidents for certain condition, lalo na nervous problems. I hope I answered that, Miss Kate. No? Thank you for that. Good morning to you.
Yes, thank you, Doc, no, for your insights on that
Mm.
very important question. So, Doc, next
Uh,
question na, can a dog suffering from tick paralysis still has the chance to recover?
okay. Yun na nga ang sabi ko kanina eh. This is the reason why you have to really prevent something like this from happening. Kasi when it reaches to the point na it has tick paralysis, it has really affected the central nervous system, especially the spinal cord, up to the brain. Okay? And you have to consult a specialist for this. Okay? A specialist. Kasi yung severity of the problem is out of hand. Ibig sabihin po, mahirap po i-measure ng mga veterinaryo, lalo na dito po sa Pilipinas. Mahirap po, buti pong nandun tayo sa mga first world countries na meron silang mga machine and tests that really determine this. Pero besides that, it's very expensive. Di ba? Yung level po nung severity nung tick paralysis niya, it has reached to a level that's very, very severe and deep. And it's very hard to measure the problem. You can only give like a remedy or paunang lunas lang para lang mabawasan man lang, pero hindi pa po yun sure na gagaling siya sa tick paralysis kasi paralyzed na siya eh. Hindi mo po alam kung ano yung naapektuhan na sa brain niya para siya ay maparalyze. Yun po. Kaya ako po, a piece of advice from me ha, huwag nyo na pong paabuti ng ganun. Bihira naman po nangyayari yung tick paralysis dito. Pag pinabayaan nyo lang yung aso nyo. Pero huwag nyo na pong paramihin yung garapata niya, gamutin nyo na kagad para hindi po umabot sa ganun. Kasi yung kasunod po nun is death. So, it's highly, severely, very, very, life-threatening, nakakamatay po yun. Pag umabot na po tayo sa tick paralysis. Sana po nasagot ko yung tanong ninyo kasi marami na rin po akong pasyenteng may ganito. Hindi na po, it's no turning back. Okay? Touch move na kayo dito pagka nagkaroon ng ganito yung aso nyo. It's very hard to cure this. Wala pong magaling na veterinaryo who is really a specialist on nervous problems. Neurosurgeon, wala pong neurosurgeon pa dito sa Pilipinas eh. Para neurospecialists para po dito sa ganitong problema. So, I hope maiwasan ninyo. I hope I answered that question, Doc. Thank you for that question.
Thank you din for your insights, no? Para lang makita nila at ma-aware sila sa severity and dun sa point na there's no turning back. Masabi, walang touch move na yan. Hindi na yan talaga magagamot pa. Or
yun.
And of course, down to the last question for this segment, Doc, no? This is first-hand experience from our viewer. On a situational basis, puppies is still at weeks old, which haven't fully opened their eyes and is still nursing, gets infested with ticks. And the mother dog also has an infestation of ticks. So how do we deal with it? Thanks. Doc.
Oh, that's a very good question. Actually, mahirap talaga gamutin yung ganyan eh. Pero you have to really consult your vet regarding this. Pero I'll tell you a story right now for you to know how it can be controlled. Okay? So you have a dog that is nursing puppies, right? Tama ba yung pagkakaintindi ko, no, Doc Raniel? Nursing puppies, may puppies siya na dumidede pa. Okay.
Yes.
So, meron pong makabagong mga gamot na pwede pong ibigay sa aso, sa nanay na aso. I think if I'm right, yes, I think yung Frontline Plus. It is the only medicine so far that I've used in the past for pregnant dogs, pregnant and nursing dogs. Spot on siya sa batok, diba? Yung Frontline Plus. Yun lang po ang safe for the past years. I'm not sure. I have to research kung pwede na po yung mga chewable tablets. Pero I think meron din pong brand na merong pwede na sa nursing and pregnant dogs. So, as I see it, marami pong garapata yung nanay, bigyan nyo po ng Frontline Plus. Kahit na po dumedede yung mga tutas, safe po yun. Okay? Ngayon, hindi mo po pwedeng bigyan ng Frontline Plus spot on yung mga tuta, yung puppies nyon. Kasi may certain age po yung Frontline Plus eh. I think it's 3 months. 2 months ba o 3 months? I'm not sure. Huwag nyo pong bigyan kasi baka mamaya masyado kayo matuwa. Ginamot nyo yung nanay ng spot on na Frontline Plus, tapos ginamot nyo rin yung tuta. Bawal po na gamutin ng Frontline Plus yung mga tuta. Toxic po yun sa kanila kasi masyado pa silang bata. Ang gagawin nyo naman po, para matanggal naman yung fleas, usually fleas eh, maraming fleas and ticks din, yung mga puppies at a very young age. What you do is you give a frontline spray dun sa mga puppies. Okay? Ihiwalay nyo po muna. Okay? Ihiwalay nyo yung bawat tuta, i-sprayan nyo siya ng frontline spray, mag-gloves po kayo. Okay? Spray nyo po yung frontline spray para hindi directly sa puppies. Spray nyo sa gloves, ikalat nyo po dun sa puppies, sa coat ng puppies. Lalabas po yung mga fleas and ticks dun sa puppies. Hiwa-hiwalayin nyo po muna for a number of hours, like 2 to 3 hours. Bago nyo po ibalik dun sa nanay. Okay? Kasi inisprayan nyo eh. Di ba? So, ang baka kasi dilaan ng nanay naman yung mga tuta, do it later, like 2 to 3 hours. Pagka nag-take an effect na, mawala na dun sa tuta, pwede na po silang dumede. Para safe din po. Kasi toxic din yung toxic yung... So, I will repeat this again. You can give Frontline Plus spot on to the mommy dog and you can spray Frontline spray dun sa puppies to remove the ticks and fleas kung infested na siya talaga ngayon. Mahirap po kasi ngayon di ba? Pagka ganun. So, ibig sabihin po nun, dapat talaga, before mo binread yung aso mo, kwento ko na po kasi ngayon, mahirap maggamot-gamot na ganyan kasi natatakot kayo dahil may tuta kayo, di ba? Kailangan before siya i-breed, meron ka nang binigay na preventive medications para hindi siya nagkakagarapata ngayon pag nanganak siya. Yun ang dapat. Okay po? Pero ngayon meron na, yung first advice ko, yung po sundin nyo. Safe po yun. Thank you for that question. Ang ganda ng question mo. Sir Alexander, thank you for that.
Yes. Thank you, Doc, no, for your siksik, liglig at umaapaw na mga tips on controlling the ticks. And of course, thank you very much, Doc, for answering all our consults. And if you still have questions and queries that you need to ask of our advice, the comment section will remain open to accommodate all of your concern about your dog. So just ask away and we'll answer them all as soon as we can. And yes, feedback is a gift because it is an opportunity to make all things better the next time around. So we would like to know your thoughts about Maxim Talks. Please answer the feedback form posted on the comment section and get a chance to win 1.5 kilogram Maxim Elite and 500 peso discount voucher to your vet clinic or pet shop of choice. And I guess that's it for today. Thank you, dearest pet parents, for being with us again today. We hope that you are able to grasp important takeaways about the little monsters living on our dog's skin and fur. So let's all be worried that ticks and fleas causes too much discomfort to our dogs and make cause serious and severe illness if remained neglected. So let's not settle with tsaka ko nagagamutin yan, konti pa lang naman yung garapata, tsaka yung fleas. Then yung konti na yun, later on, it will hatch into millions of eggs and problems will keep on piling up. So early treatment bears high chance of treatment success. So keep in touch always with your veterinarians for advices about ectoparasitosis. And of course, thank you, Doc Jommer, for helping our dear viewers to learn more about ticks and fleas. So, Doc, do you have any parting words to our avid viewers?
Yes, I want to thank everybody for watching us here. And I'm expecting that you'll be also viewing us next time on our next episode with very, very juicy topics, very important topics. I'm really glad to share. I want to thank Maxime Talks for everything, for Pilmico, your group, Dr. Raniel, and the staff. I want to thank you for joining us here. I'm here all the time. You can message me. I have a page and a group. It's called Consult a Vet. I have also a clinic. My practice is Consult a Vet Hospital in Tandansora, Quezon City, and Book Vet Clinic in Capitol Hills Drive. There is a number that is located here in the presentation where you can call me. You can message me anytime so that I can help you out with your question regarding your pets. Thank you guys very much.
All right. Thanks again, Doc Jomer. And once again, thank you for tuning in and please watch out for the next episodes of Maxim Talks. So this has been your host, Dr. Raniel Montero, reminding all pet parents out there to always do good for your doggos. Bye-bye.